Welcome to Doctor Health Hub, where every episode begins with a doctor tip you can trust. Today we're talking about first aid basics for everyday injuries, cuts, burns, and open wounds. I want to start with the most common question. Someone in your house gets a cut and it's bleeding. What is the very first thing you should do?
Step 1 is pressure. Put clean, direct pressure on the cut with clean gauze, a clean cloth, or even your clean hand if that's all you have. Don't panic. Most everyday bleeding will slow down just with firm, steady pressure for a few minutes. Hold it. Don't keep lifting to check. Every time you lift, you let it bleed again.
So we press and hold. Do we rinse it right away or stop the bleeding first?
If it's bleeding a lot, control the bleeding first. Once it's slowed down, then rinse the wound. Use clean, running water, gently, to wash out dirt, dust, glass, sand, anything that doesn't belong there. You do not need harsh chemicals. You do not need alcohol or hydrogen peroxide deep in the wound. Those can actually irritate the tissue and slow healing. Clean water plus mild soap around, not inside, the cut, is usually enough for basic cuts.
After it's clean, what's next? Do we leave it open to air out or cover it?
Cover it. A moist, protected wound actually heals better than a dry, crusted, exposed wound. You can put a thin layer of plain antibiotic ointment on the skin edges if the person isn't allergic, then cover with a sterile bandage or clean dressing. Change that dressing at least once a day or sooner if it gets wet or dirty.
When does a cut need stitches instead of a Band-Aid at home?
Good rule. Get urgent care if the cut is wide open or you can see fat or deeper tissue. The edges won't stay together. It's longer than about 2 centimeters, close to an inch. It's on the face. It was caused by something rusty or dirty, like a dirty metal edge or an animal bite. Also go in if bleeding does not slow after 10 minutes of steady direct pressure. That's not watch and wait. That's a you go now.
Okay, let's move to burns. Let's say someone in the kitchen touches a hot pan and burns their hand. What is the first thing you do for a burn?
Cool the burn, not ice it. Put the burnt area under cool running water or press a clean, cool, wet cloth on it for about 10 to 20 minutes. Cooling helps pull heat out of the skin and limits how deep the burn goes. Do not put ice directly on it. Ice can actually injure the skin more. Do not put toothpaste, butter, oil, egg, or random home remedies. Those can trap heat and increase infection risk.
After cooling, how do you protect a small burn at home?
Pat it dry gently, then cover it with a clean, non-stick dressing. You want protection from friction and dirt. If a small blister forms, do not pop it. That blister is a natural bandage. Opening it early increases infection risk.
And when is a burn not home care, but this is serious? Get help now.
Get urgent medical care if the burn is larger than the size of the person's palm. The burn is on the face, hands, genitals, or over a joint like the knee or elbow. The skin turns white, black, leathery, or numb. That can mean a deep burn. There's any trouble breathing after fire, smoke, or explosion. Those are not wait and see. Those are go now.
Let's talk infection. How do you know a cut or wound might be getting infected later?
Watch for redness that's spreading, warmth that's spreading, pus, bad smell, or pain that's getting worse instead of getting better after the first 24 to 48 hours. Also watch for fever. If you see red streaks going up the arm or leg from the wound toward the body, that needs medical attention quickly.
What about cleaning a scrape on a kid's knee after they fall outside?
Same basics. Rinse with clean running water to get gravel and dirt out. Gently wash around it. Pat dry. Thin ointment if not allergic. Then cover it. Kids always want to leave it open, but knees bend, pants rub, playgrounds are dirty. Covered is safer and usually hurts less because air isn't hitting raw nerve endings all day.
Let's say the wound won't stop bleeding, the burn looks bad, or the person feels weak or lightheaded. When is it emergency level?
Emergency care right now if bleeding is heavy and constant, even with firm direct pressure. The blood is pulsing out, that can mean an artery. You can't wake the person or they're getting confused. There's a deep burn or electrical burn. There's any sign of inhaling smoke and now there's trouble breathing. Those are not called tomorrow. Those are go now.
I want you to talk directly to the person who says, "It's just a small cut. I'll rinse it later. I'm busy."
Please don't ignore open skin. Infection moves fast, especially in people with diabetes, poor circulation, or weaker immune systems. Clean it now, cover it now. And if something looks wrong, redness spreading, fever, worsening pain, get checked early, not late.
Give me the short summary I can remember in stress.
For cuts, pressure first, clean water next, cover it. Get help if it's deep, gaping, on the face, or won't stop bleeding. For burns, cool running water, not ice. Cover gently. Don't pop blisters. Get help if it's big, deep, or on the face, hands, or groin. For any wound, redness spreading, pus, fever, or red streaks, see a professional.
Thank you, doctor. And thank you for watching Dr. Health Hub, where every episode begins with a doctor tip you can trust. Your health is your wealth. Stay tuned for the next doctor tip you can trust.
Medical education only. This video is not personal medical advice. If you think it's an emergency, please seek urgent care immediately.